It turns out that most able-bodied adults on welfare aren't working, and many enrollees tend to remain on the books for years, not weeks or months. For conservatives, it is likely this isn't surprising to you. After all, we have been warning about the dangers of allowing the government to sustain people for as long as any of us can remember. But the Idaho legislature, despite being a supermajority Republican body, still works to expand welfare benefits. The cost of this is borne by the taxpayers who are struggling to make ends meet. Meanwhile, many are taking advantage of the work-free lifestyle of being on the government dole. So on this week's episode of Fiscal Fridays, we are digging into the latest numbers on Idaho's welfare state and what it means for the taxpayers footing the bill. Newly released reports from the Idaho Department of Health and Welfare reveal the state of the welfare culture in Idaho. These reports describe the 6 largest programs within the Division of Welfare: Medicaid, food stamps, cash assistance, child care support, employment and training, and aid to those with disabilities. What the analysis reveals is shocking. In 5 of Idaho's 6 largest welfare programs, fewer than half of enrolled able-bodied adults have a job. Food stamps, Medicaid, and cash assistance are some of the most egregious examples of this. The reports also show that many enrollees stay on the program much longer than they should, with many staying on the rolls for years. The range runs from an average of 2 years, 7 months for those on food stamps to 4 years, 10 months for Medicaid. Keep in mind that these programs are designed to be temporary, short-term safety nets, not long-term handouts. Some might argue that programs like Medicaid have a longer average duration of enrollment because they care for chronic patients like the elderly and disabled. Though this is partially true, these populations make up less than 20% of the total enrollment of the program. The remainder of the enrollees are pregnant women, children, and able-bodied adults, all enrollees that should be dragging the average enrollment time down. The problem with the system as it is today is the perverse incentives therein discourage work at a steep cost to the taxpayer. Some on the left argue that enrollees avoid work to be able to keep their benefits. This is because they will no longer qualify if they make too much, disincentivizing advancement and entrapping people in these programs. This is called the welfare cliff. Though this is a concern for some enrollees, the welfare cliff is not what is at play here. It turns out that few enrollees are even close to the income threshold. In fact, except for the enrollment and training program, less than 2% of the enrollees come within 10% of the maximum income limit. Besides, if you could earn up to a certain amount to keep your benefits, why are there so many people not working at all? It turns out that generous welfare benefits are partially to blame. A report from the Foundation for Government Accountability found that those on welfare could get someone $4.11 more per hour than the median wage in Idaho. This is equivalent to roughly $46,000 in an annual salary. And with benefits becoming even more generous, why bother? In Medicaid, for instance, you could get dental, prescriptions, and vision covered. Mind you that these are optional add-ons the state of Idaho chose to include in Medicaid benefits. These are the same benefits many Idahoans on private insurance can't even afford for themselves. Legislators are now armed with the data never accessible to them before. It is time that they capitalized on it. This data is a major about-face from the policies of the prior leadership within the Department of Health and Welfare. In releasing these reports, new leadership within the department created the transparency that lawmakers and constituents alike need. Lawmakers shouldn't be expanding welfare programs. Rather, reforms are necessary to refocus on what should be the mission of getting people off the government dole and into self-sufficiency. It is unfair to the taxpayers footing the bill to enable a culture that relies on the government to sustain one's basic needs. As we wrap up, remember this: more generous handouts and allowing forever enrollment won't help Idahoans. Rather, the most benevolent policy to taxpayers and program enrollees alike is to reduce the size of welfare programs and encourage disenrollment and self-sufficiency. Otherwise, Idaho may soon find itself in a situation where there are too many on assistance and too few supporting the system. Thank you for taking the time to watch this week's episode of Fiscal Fridays. To continue to support the Idaho Freedom Foundation's message of liberty, be sure to like, subscribe, and spread the word. Also, to get all the latest updates from IFF, please visit idahofreedom.org.